just as a reminder, I think you guys have been through this, many of you from prior years. If not, you're going to have this card here. There's going to be 5 presenting companies. The first up is 6DOT, and this is Karina. She's going to go through this. The way it's structured is there's 6 minutes of presentation, and there's 4 minutes of Q&A. I wanted to introduce our panel, Ted Driscoll from Claremont Creek, and Evgeny Zaitsev from Helix Ventures. Venture capitalists in this space, so they're going to basically be running the panel and also assisting with some of the questions and Q&A. Again, we have 4 minutes at the end, questions for the panel. So without much ado, if we can get started, and then who's the cue card person? And she's right there, Karina, so we can get started.
You guys only get 4 minutes too, so I'll give you the 1 minute. Okay? That's what they told me.
They give you a whip?
Yes.
Okay. Let's get started.
Great.
Okay.
Well, good afternoon, everybody. My name is Karina Pickart, co-founder of 6DOT Innovations. I'd just like to start by introducing myself to you a little bit. During my sophomore year of college at MIT, I had the opportunity to travel to a ski camp for amputees where I volunteered. And I went there as a mechanical engineer interested to learn what sort of technology enables somebody without one leg or perhaps without both legs to ski down a mountain. And I left there completely inspired by the folks I had met and gone on during my time at MIT to develop prosthetic legs, which I built, tested, and took to India, which I put onto customers' legs, had them try it out, and had them leave the facility walking. Since then, I've been incredibly interested in assistive technology, and it's not just the technology itself, but also what you learn about the potential of the human spirit in working with folks who have disabilities and who have overcome incredible obstacles. And I know it's not just me that's inspired by this. You can look at some of the literature that's out there, a book about the first blind man to summit Mount Everest. Likewise, Crashing Through, a book about Michael May, the world's fastest blind downhill skier, who skis 65 miles per hour clocked, twice what I ski. Anyway, all of this to give a hint at the incredible power of the human spirit, especially when you look at folks with disabilities who have been given opportunities with assistive technology. Along with my co-founder, Trevor, we founded 6DOT Innovations out of MIT's Mechanical Engineering Department with the idea of developing some of this technology that can enable people in their lives. We're joined by a team of 6DOT innovators based here in Palo Alto today, and a really incredible team of advisors, which includes folks with experience in manufacturing and marketing, as well as Michael May himself, who can outski me any day. Assistive technology represents an almost $9 billion global market, of which 70% is captured by the area of sensory impairments. That's blindness and hearing impairment as well. And that's the space I want to start in today when I tell you our story. So you see these cans are labeled, and you can imagine in a world without labeling, we'd all be kind of lost, maybe confused. And yet for 37 million blind individuals around the world, this sort of represents what their daily experience is, interacting not just with canned goods, but perhaps with prescription medication bottles. A study out of the American Federation for the Blind in 2008 reported that 100% of people who participated in the study had at some point taken the wrong prescription medication by accident and suffered consequences ranging from mild to severe, including hospitalization. The solutions to that problem available today don't really solve the problem at all. The Slate and Stylus, which I have here, requires manually punching each dot into a tape from right to left and each character in reverse, so it's very non-intuitive. On the other end of the spectrum, the KGS Labeler is a $1,300 product, so prohibitively expensive to most consumers, and on top of that has an LCD screen, which our users can't make heads or tails of. We've developed the 6DOT Braille Labeler. It's up here. It's a tool that's portable, battery-powered, and easy to use. It enables a person to create Braille labels on the go as a pharmacist might hand them those prescription medication bottles. They can create labels that will indicate how you properly use that medication and what this bottle is compared to that one. Let me show you how it works. This is a video of Ben, a child, testing one of our earliest working prototypes. You see he types really quickly and adeptly on its keyboard interface, that he can read the Braille that's coming out of the machine in real time, and also that he has a really joyful and pleasant experience doing so. And that's not just because we've focused on elegant product design, but also because of the educational benefit that Ben gets out of a product like this, an early exposure to Braille and Braille literacy that he can't find in other products today. Well, we've also focused really heavily on technical innovation, being a team of MIT mechanical engineers at heart, and our patent-pending Braille embossing mechanism is an example of that. The mechanism enables Braille to be created in any language around the world, and also you can create math, written music. The quality of the Braille is really not compared in any other product. Because it's a powered device that runs on AA batteries, the Braille is crisp and clear, and our users have compared the quality of that Braille to what they imagine neat handwriting or tidy handwriting must look like. And finally, the ease of use. A child like Ben can use our product because it's a powered system, not one of these mechanically driven ones that's available today, which a child might not have the hand strength to use. For this work, we've been recognized in a number of ways. I just want to highlight that we were featured at the SolidWorks World Conference, that the ASME has financially backed our work, the Society of Mechanical Engineers, and that we've been featured on Engadget as well. So if you look at the products in the space, they range from high performance, high cost to low performance, low cost, and we're really strategically positioned to deliver high performing products at a low cost to our end users. For this product alone, our revenues will come not just from the labelers and software add-ons that become available, but by the consumables, the labeling tape, which represent a recurring revenue model for us. And strategically moving forward, we plan to expand from the B2C space, where we're entering, selling products to just the consumers, to the B2B space, targeting grocery stores, pharmacies, hotels, airports, you name it, that need to provide accessible environments to folks with disabilities. Just to sum up, we've got a really passionate team that's worked to build 13 labeler prototypes to date that are out in the field being tested. In the last couple days, I made 250 labels in the course of 45 minutes, which show just the scalability of the work that we're doing. We filled our customer pre-orders for our product launch, which we expect to happen in Q4 this year, and I thank you for your time.
Thank you very much. It's a good presentation, and certainly you're addressing a very important problem. Can you talk a little bit more about the market? What do you think are the main drivers in this market? In particular, all these commercial customers, why do you think they will use Braille labeling? They sell a lot of products today without any labeling, and they sell them well. Mm-hmm. And also the individual customers, why do they need the product? Can you explain that a little bit?
Sure. Well, I can start by talking about the B2B space.
Mm-hmm.
I think this will largely be driven by government mandates. Okay. You know, it's unbelievable that the FDA still gets away with, allowing pharmacists to hand out prescription medications without accessible information. And I know that's going to change. Congress has already issued that, these things are reviewed. Grocery stores provide wheelchairs with grocery carts to their consumers. So at some point, the government will mandate that if corporations don't step up and do that, out of their own corporate social responsibility. From the consumer side, the product is very much needed. We see it in the demand that the customers have pre-ordered our product. In this space, you don't often see a lot of competition. About 70% of people will own a product like this, a Braille typewriter. So we see ourselves as having a great potential to capture a large percentage of the market rather quickly if we enter quickly and scale quickly.
Okay, if I can give you a quick comment on the commercial side. Since this market is very government-driven, you probably need to have some explanation in your presentation how you are going to address that issue, you're going to work with the government, and mm-hmm. how you will sort of capture that value.
Sure. And I can just say that we're already having some early conversations with some of these potential customers, and so that process is already rolling.
Thank you.
So how big is the total available market? In other words, the big high-performance, high-price companies that you mentioned in your competitive chart, mm-hmm. how big are their sales?
So there aren't examples I can draw of public companies in this space, and that
they're
information.
All private, you're
they're
saying.
All private companies. Yeah. For the Braille labeler alone, we see ourselves as having $1 billion TAM. There's 37 million blind people around the world. This is a $300 retail product, and then factor in the Braille literacy rates, who's actually using Braille, and for this product alone, that's $1 billion without counting the recurring revenue from the rolls of tape, which is very much the business model that we'd be using.
And do you have some intellectual property protection around what you've done? Is there something unique about what you've done that
right.
can't be done by anyone else?
Well, the underlying technology is in the Braille embossing mechanism. It's done differently than anyone else does it, and it's defended or defensible by the IP that we filed.
Is that the only way that, however, to do it, or could someone come up with a different way to do it?
You know, there are possible ways of developing, I suppose, knockoffs, so to speak. This is sort of our entry product into the market. There's a whole portfolio of products that we anticipate developing. And so while I'm not exactly sure that we can defend this product to the very core, I think the brand value will gain from being the first company that invented a product people had waited for 30 to 40 years will add tremendous value to us.
I think we're running out of time.
Karina, the Freedom Scientific, how much is their device?
Which device is that?
Which is comparable to this one, the one that you consider to be a competitor.
Oh, so KGS released the labeler I showed on the right
Yeah.
side. That's a $1,300 product. That's
Yours-
KGS, not Freedom Scientific. And
Does
that's it.
Freedom Scientific have a competitor product? in this?
No, I don't
No.
think so. They have lots of products, but I don't think they do labeling.
They have something like that.
Thank you.
Great, thank you.
Thank you.
Thank you. You may, yeah. Is that EJ? Yes. EJ, how are you? Frank Romani.
Sure. Okay, and
The next company is CaraMed. CaraMed's developed minimal invasive devices for treatment of blindness and vision correction. Their first product, I believe, is a new ocular implant that's delivered through microincisions.
that's right.
So we're going to talk a little bit about that.
Okay, thank you all for being here. I'm Dr. E.J. Shui, and I'm a corneal transplant surgeon. I'm a practicing doctor, and I work at the Palo Alto Medical